Learn the proper procedure for IV cannulation in less than 3 minutes. Here is a step-by-step guide. Now the procedure. You have to gather your equipment, such as the IV cannula with the appropriate size, the IV fluid or the medication to give, the alcohol swab, a tourniquet, a gauze, and an adhesive tape, and also 2 ml normal saline for flash. And now you choose the appropriate vein. Determine whether you want to pick your vein from the cephalic vein in the arm or the dorsal vein of the hand. Ensure patient consent and comfort. So this is where you give reassurance. Reassure the patient, explain procedure to the patient as well. And now the procedure itself. You prepare the skin. You clean the area with an alcohol swab, and you allow the skin to dry. After that, you apply the tourniquet 2 to 3 inches above the chosen vein, not too tight, just enough to restrict blood flow. And now you identify the vein using your index finger to palpate the vein. You visualize the vein by looking for a slight bulge. And now you insert the cannula. And it's usually held at the angle between 10 to 15 degrees. Insert the cannula into the skin, aiming for the vein. And now you advance the cannula until you feel resistance, indicating the vein has been entered. After that, you see blood flashing back. That is showing that the cannula has entered through the vein. And now you secure your cannula, remove the tourniquet, and use adhesive tapes to secure the cannula in place. Other people use the flash to check the patency before securing the vein. But if there is blood coming out showing that there is the cannula is already in place, then you have to secure your cannula before you use the flash to check for the patency. That is all I have for you. Don't forget to subscribe and also like this video. Thanks for watching.